Ever wondered what exactly is asthma and how it's classified? Take a moment to ponder on that. Asthma is this chronic condition that affects a crucial part of our breathing system, the airways in the lungs. These airways, also known as bronchial tubes, serve a vital function, allowing the air to flow in and out of the lungs with ease. But imagine if you have asthma, these inner walls of your airways undergo a transformation. They become inflamed and swollen, and as a result, the passage narrows and breathing becomes a strenuous task. This inflammation can create a spectrum of symptoms, ranging from minor inconveniences to situations that pose a threat to life. Asthma is not a one-size-fits-all condition. Surprisingly, it's classified into 4 categories, each based on the severity and the frequency of symptoms. Let's start with the first category, intermittent asthma. This is considered the mildest form. Here, symptoms occur less than 2 days a week, and they don't pose much interference with daily activities. Moving on to the next, mild persistent asthma. In this type, symptoms make an appearance more than 2 days a week, although not every day. They may slightly hinder daily activities, but not to a significant extent. Then we encounter moderate persistent asthma, where symptoms occur daily and may indeed limit some daily activities. Lastly, we have severe persistent asthma, the extreme form. Here, symptoms occur multiple times a day, significantly limiting daily activities and often leading to frequent severe attacks. These classifications are not just labels. They assist healthcare professionals in creating treatment plans that can manage the condition effectively. So, whether you're dealing with an occasional wheeze or daily disruptions, understanding the type of asthma you have can be a game changer. Now that you've gained an understanding of what asthma is and its various types, let's delve into how it affects our body. But how does asthma affect your body's functioning? Well, let's dive into the pathophysiology of asthma to understand this better. Asthma is a chronic respiratory condition characterized by 2 key features: airway inflammation and airway hyperresponsiveness. Let's break down these terms. Airway inflammation is a persistent feature in asthma. Here, the airways in the lungs become inflamed and swollen. This inflammation is due to an overactive immune response to certain triggers, which can be anything from pollen to cold air. When the airways become inflamed, they produce excess mucus, which further narrows the airways and makes breathing difficult. Now, onto airway hyperresponsiveness. This is a fancy term for the airways being overly sensitive to triggers. When exposed to these triggers, the muscles around the airways tighten, causing the airways to narrow further. This process is known as bronchoconstriction. These 2 key features, inflammation and hyperresponsiveness, work together to cause the typical symptoms of asthma. When the airways are inflamed and constrict in response to triggers, it leads to symptoms like wheezing, shortness of breath, and chest tightness. So, in essence, asthma is a result of your airways overreacting and going into overdrive when they come into contact with certain triggers. It's like the airways are throwing a tantrum, causing havoc for the person experiencing it. But it's not all doom and gloom. Understanding the pathophysiology of asthma is the first step towards managing the condition effectively. With the right treatment and management strategies, it's possible to keep the airways tantrums under control, helping those with asthma to lead normal, active lives. Armed with this knowledge, let's now explore what triggers this response in our body. Could you be at risk of developing asthma? Let's delve into the common risk factors that could increase your susceptibility. Firstly, genetics plays a significant role. If a parent or sibling has asthma, your chances of developing the condition are higher. It's all in the family, so to speak. Next, allergies are a major culprit. Those with allergic conditions, be it hay fever, eczema, or food allergies, are more likely to have asthma. It's like these allergies open the door for asthma to walk right in. Finally, we have environmental triggers. These are elements in your surroundings that can ignite asthma symptoms. They include tobacco smoke, pollution, and even certain weather conditions. Picture them as silent invaders causing chaos in your airways. Moreover, occupational hazards like chemical fumes, dust, or gases in the workplace can also contribute to the onset of asthma. Simply put, your occupation could be putting your lungs at risk. Understanding how these factors can contribute to the development and progression of asthma is key. It's like piecing together a puzzle. Each factor, a piece that brings us closer to the bigger picture of this complex condition. Recognizing these risk factors can help in early detection and management of asthma. How do you know if you or someone you know is experiencing an asthma attack? Well, there are several telltale signs that could indicate an ongoing asthma attack. One of the most common symptoms is wheezing, which is a whistling sound when you breathe. It's usually more noticeable when exhaling. Another key symptom is shortness of breath. People with asthma often feel like they can't catch their breath or feel breathless, as if they can't get air out of their lungs. Other symptoms include a feeling of tightness in the chest, like something is squeezing or sitting on your chest. Now, symptoms alone may not be enough for a definitive diagnosis of asthma. Therefore, doctors use certain key clinical assessments to confirm. These include spirometry, peak flow measurements, and bronchodilator reversibility tests. Spirometry is a simple test used to help diagnose and monitor asthma. It measures how much air you can breathe out in one forced breath. On the other hand, peak flow measurements involve using a small handheld device to measure how hard you can breathe out. If your peak flow readings are lower than usual, it's a sign your asthma may be getting worse. Lastly, bronchodilator reversibility tests are used to see how well your lungs respond to bronchodilator medication. If your lung function improves with the medication, it's likely you have asthma. Remember, these symptoms and tests are important not only for diagnosing asthma, but also for managing it. Regular monitoring of symptoms and peak airflow can help prevent complications and improve quality of life. Prompt recognition of an asthma attack and early intervention can be life-saving. Understanding these symptoms and diagnostic tests can help in timely intervention during an asthma attack. But not all wheezing and breathlessness is asthma. While asthma is a common cause of these symptoms, other conditions can mimic its presentation. One such condition is chronic obstructive pulmonary disease, or COPD. Unlike asthma, COPD is characterized by a persistent, progressive airflow limitation that's not fully reversible. It's often associated with an abnormal inflammatory response to harmful particles or gases, particularly in heavy smokers. Another condition that can mimic asthma is vocal cord dysfunction, where the vocal cords close when they should be open. This leads to symptoms like wheezing and difficulty breathing, similar to asthma. But the key difference lies in the triggers. Vocal cord dysfunction can be triggered by stress or strong emotions, not the allergens or irritants that typically set off asthma. Differentiating asthma from these other disorders is crucial. Asthma is usually diagnosed through a combination of clinical assessments and tests like spirometry, peak flow measurements, and bronchodilator reversibility tests. For COPD, a spirometry test showing poor reversibility of symptoms following a bronchodilator can be indicative. As for vocal cord dysfunction, a laryngoscopy is often used. Knowing the difference can help ensure appropriate treatment and management. Distinguishing between these conditions is vital as they require different treatment approaches and management strategies. So how do we manage this chronic condition? Asthma, while chronic, can be effectively managed. The key to this is a stepwise approach. This approach involves starting with a basic level of treatment and stepping up or down based on the patient's response. The first step is controller medications. These are long-term treatments, usually inhaled corticosteroids, that help reduce inflammation and prevent asthma symptoms. They're like your everyday shield against asthma. Next, we have rescue medications. These are short-term treatments, usually quick-acting bronchodilators, that relieve acute symptoms during an asthma attack. They are your emergency responders, coming to the rescue when you most need them. However, managing asthma isn't just about medications. A significant part of it is patient education and self-management plans. Understanding one's condition, recognizing early signs of an attack, knowing how to use medications correctly, and avoiding triggers are all crucial elements of managing asthma. For severe asthma that doesn't respond to usual treatments, there are emerging therapies and biologics. These are advanced treatments that target specific cells or proteins in the body to control inflammation. They're like the special forces called in when the regular troops need reinforcement. But remember, Every person's asthma is different, and so are their treatment plans. It's essential to work closely with a healthcare provider to find a plan that works best for you. With proper management and education, asthma can be controlled and one can lead a normal, healthy life.